Welcome.
Hi, I'm Tina. I'm a medical student from Slovenia, and I've been a part of the focus groups that we did last year. And today I will present challenges and experiences of families living with CTNNB1 syndrome. CTNNB1 syndrome is a rare neurodevelopmental disorder with broad spectrum of clinical features that significantly impact both patients and their families. Most affected children present with axial hypotonia, leading to delayed motor development, feeding difficulties, and in some cases, peripheral spasticity, resulting in scoliosis or foot deformities. Microcephaly and a range of visual impairments such as strabismus and retinal abnormalities are also common. Motor and speech development are frequently delayed with significant variability between individuals. Additionally, many families face behavioral challenges, including autistic features, sleep disturbances, ADHD, and self-injury. These complex and diverse manifestations not only affect the medical care of patients, but also place emotional, physical, and logistical and financial burdens on their families. In this presentation, we will explore these challenges in more depth and discuss the lived experiences of families navigating life with CTNNB1 syndrome. Parents carry a 24/7 caregiving responsibility, often leading to both emotional and physical exhaustion. They face the challenge of navigating a fragmented healthcare system and must constantly advocate for their child's needs in educational and social settings. Financial pressures are common, as many parents give up career opportunities to provide care. On top of that, they often experience social isolation and stigmatization, which further adds to the emotional burden. Research focusing on CTNNB1 syndrome is needed, as current standardized questionnaires often fail to capture the full complexity of child's daily functioning and the nuanced challenges families face. Unlike many severe genetic conditions, CTNNB1 syndrome does not typically lead to early mortality. As a result, neurodevelopmental disorders like CTNNB1 are sometimes mistakenly perceived as manageable, or even romanticized with the notion that these are happy children. This oversimplification overlooks the continuous uncertainty, emotional and physical exhaustion, and countless adaptations that parents navigate daily, while at the same time providing the children with immense love, dedication, and hope for the future. By giving parents a voice, those who are often in the background of clinical decision-making yet carry the greatest burden, this research aims to reveal their lived experiences, real needs, and priorities. Understanding these perspectives is essential not only for improved medical care and guiding healthcare providers, but also for shaping supportive programs that address families' practical, emotional, and social needs. We are conducting a qualitative study using focus groups, applying a constructivist approach where knowledge is co-created through shared experiences and discussions. The research team includes physicians, medical students, psychologists, and researchers. A total of 28 primary caregivers of children with CTNNB1 syndrome are participating in the study. Participants have been selected to ensure diversity in terms of geographic location and social background. Data saturation is being monitored throughout the research process to ensure comprehensive coverage of the key themes. The study includes one pilot and 3 in-person focus groups, each lasting 90 to 120 minutes and guided by semi-structured questions. The discussions explore a range of topics, including emotional, physical, social, and financial aspects of caregiving, as well as perspectives on symptom management in the context of potential innovative therapies. 2 researchers independently coded the data, followed by joint discussions to refine the coding framework. This process led to the development of overarching themes and subthemes, supported by representative participant quotes to illustrate key findings. Methodological rigor was ensured through triangulation and participant validation. Families of children with CTNNB1 syndrome face a range of challenges, including behavioral difficulties, motor impairments, constant caregiving responsibilities, and emotional exhaustion. Daily life is further complicated by feeding issues, incontinence, social exclusion, and the impact on siblings. Now we will briefly go through each of these subtopics to get a closer look at the specific challenges families encounter. Participant described intense behavioral outbursts, including self-injury, headbanging, slamming doors, and meltdowns that can be extremely difficult to manage, especially in public places. Much of this distress is closely linked to communication difficulties. Caregivers also reported the sensory sensitivities, such as loud noises or sudden changes, can easily overwhelm the child, triggering panic, self-harm, or aggressive behaviors. In addition, repetitive behaviors and obsessions, like fixations on certain objects or routines, can dominate daily life and contribute to parental stress and isolation. Participants described the significant physical, emotional, and logistic challenges associated with limited mobility. Being in a wheelchair not only restricts the child's ability to escape or respond when frightened, but also requires constant physical assistance for transfers, transportation, and daily care. Families emphasize how mobility limitations deeply affect their daily lives, from needing special vehicles, modifying homes, dealing with damaged walls, and managing frequent infrastructure changes at home and school. As children grow heavier, the physical strain of lifting and carrying becomes increasingly overwhelming for caregivers, who also worry about their ability to provide care as both the child and the parents age. One of the most significant challenges reported by caregivers was the lack of communication. Many children are unable to express basic needs, emotions or discomfort, which leaves caregivers constantly guessing whether the child is in pain, hungry, sick, or distressed. This uncertainty is particularly difficult in situations where the child may have experienced harm or mistreatment, as they are unable to report or describe what happened. As a result, parents often feel they must remain hypervigilant at all times to protect their child. This communication barrier also limits access to alternative caregivers, as even close family members may struggle to interpret the child's nonverbal cues. Overall, the inability to communicate creates a constant state of emotional stress, uncertainty, and isolation for families. Caregivers constantly describe profound chronic fatigue from caring for a child with syndrome. Sleep disturbances are frequent. Many children wake up multiple times during the night for years, leaving parents in a state of permanent sleep deprivation. Beyond physical tiredness, caregivers experience mental exhaustion from constant 24/7 vigilance to monitor safety and health. This ongoing alertness causes emotional burnout, isolation, and physical symptoms similar to chronic illness. Unlike typical infant care fatigue, this is lifelong, creating what one participant described as a marathon without an end. Daily routines become unpredictable and overwhelming, often forcing caregivers to sacrifice personal well-being, hobbies, and social life due to lack of energy and time. Caregivers describe the overwhelming level of dependence their children have in daily life. Feeding can take 1 to 2 hours per meal, often requiring constant engagement to ensure sufficient intake. Many children remain incontinent and fully reliant on others for basic self-care, such as dressing, hygiene, and toileting. The lack of autonomy extends into play and daily routines, with children needing constant supervision. Families also face challenges adapting their homes for safety and managing difficult behaviors in public and private settings, which limits participation in everyday activities and affects siblings and the family life as a whole. Sub-themes social exclusion and isolation reflect the emotional and social consequences of caring for a CTNNB1 child. Families mention social exclusion, loss of friendships, and limited participation in community life. They mention their children are sometimes excluded from school systems or they cannot find the right place for them due to behavioral problems, sensory issues, and a lack of inclusive infrastructure. Parents, in turn, feel isolated, cut off from other parents, unsupported, and without options. Siblings often live in the shadow of the child with special needs, with parents' time and attention primarily focused on therapies and care. This can lead to feelings of neglect and missed childhood experiences. While some siblings develop deep empathy and resilience, others struggle with complex emotions, including frustration and confusion about their brother or sister's condition. Let's now turn to the second topic, focusing on fears for the future and hopes surrounding treatment. Parents express deep fears about their child's long-term future, especially who will care for them when they can no longer do so. Lifelong dependence brings feelings of helplessness and exhaustion. Many have made major life changes, like giving up careers to focus on caregiving. Anxiety about the future leads many to focus on the present. Despite challenges, some find hope in research and medical advances. Parents emphasize the need for a supportive community, but often feel isolated due to caregiving demands. Small connections with others provide important relief. When reflecting on priorities, parents repeatedly highlighted the central importance of improving communication. The inability to understand their child's needs, especially during illness or distress, is a major source of worry and helplessness. Small gains in communication would significantly improve both the child's and the family's quality of life. Gains in motor independence, like self-feeding or walking, would ease caregiving and help family regain normalcy. Better emotional regulation and behavioral stability were also key goals, with hopes to reduce outbursts without heavy medication, to improve social and learning opportunities. This research has provided a deeply insight into the daily challenges faced by families of children with CTNNB1 syndrome, not only medically, but also emotionally, socially, and financially. The voices of parents were central to this study, helping to illuminate the realities of life with a rare disease and to highlight the urgent need for a holistic approach in developing therapeutic and supportive strategies. Beyond understanding the challenges, their stories have also reminded us of the strength of hope, resilience, and love, and the importance of working together towards change. As new therapeutic options are being developed, it is equally important to build an environment that allows these children and their families to live dignified, inclusive, and as independent lives as possible. The next step is clear: connecting the scientific community, clinicians, parents, and policymakers into one joint effort, a shared story that leads to a meaningful change. Thank you.